Nebulization is a process of dispersing a liquid or medication into microscopic particles and delivering into lungs as patient inhales through the nebulizer. It is also used to liquefy and remove retained secretions from the respiratory tract. First, we do hand hygiene and clean our hands with soap and water or aerosol-based hand gel, then put on a non-sterile gloves. It is to prevent the transfer of the microorganisms. And then we do identifying our patient and check the physician's order and explain the procedure to the patient. It is to ensure the right procedure is to be done to the patient and ensure patient's cooperation and effectiveness of the treatment. And then, I will gather the equipment such as nebulizer machine or neb machine, neb tubing, neb cup, the nebulized medicine ordered by the doctor, and the delivery device. It is to ensure the proper delivery of the medication. And then place the patient in a comfortable sitting or semi-fowler's position. This is to improve the lung expansion and medication distribution. And then put the neb machine on a hard flat surface and plug it into an electrical outlet. Connect the neb tubing to the air outlet port and the other end on the air inlet port of the neb cup. It is to ensure the proper delivery of medication. And then remove the cover from the neb cup and pour the ordered amount of medicine into the cup and reattach the cover. Be sure to perform the right 6 of given medication. Right patient, right medication, right dose, right route, right time, and right documentation. And then connect the delivery device to the neb outlet. It is to ensure the proper delivery of the medication. Then turn on the neb machine, then place the mouthpiece on the patient and begin the neb treatment. A fine mist should be visible from the delivery device. It is a process verifies that equipment is working properly. Keep the neb cup upright as possible during the treatment. Gently tap the cup every 2 to 3 minutes to move droplet of medicine to the bottom of the cup. This is to ensure the patient receives all the medicine. And then instruct the patient to breathe slowly and deeply until all medications is nebulized. Approximately 15 minutes when there is no more mist coming out. This is to maximize the effectiveness of the medication. And then remove the delivery device and neb cup from the patient and then turn the neb machine off and disconnect the tubing. It is to promote the patient comfort and safety. In completion of treatment, encourage the patient to cough after several deep breaths so that the medication may dilate airways. It is to help remove the expectorate mucus. And then observe the patient for any adverse reaction from the treatment. Patient may develop bronchospasms due to inhalation of aerosol and may cause dry and retained secretions in airways. And then document the medication used and the description of the secretions expectorated. The proper documentation is a proof that work is done and observed. And lastly, disassemble and clean nebulizer after each use. Rinse, dry, and keep the equipment in the patient's room. It is for the proper care reducing the transfer of microorganisms.